Microorganism that I received is hepatitis D. It is a satellite virus, which means that it requires another virus in order to enter your cells. Hepatitis D is the only virus in the genus Deltaviridae. Hepatitis D is a co-infection that requires the patient to be currently infected with hepatitis B. The infection can be contracted at the same time as hepatitis B as a co-infection or in a person that already has chronic hepatitis B, resulting in a superinfection. Hepatitis D virus is a small single-stranded RNA genome that can only encode on one virus-specific protein called the delta antigen. The optimal environment for hepatitis D is the liver cells of humans. Hepatitis D can be very serious if it is a superinfection, meaning that it is chronically infected with hepatitis B and then you contract hepatitis D. In these cases, you have a 70 to 90% chance of getting a chronic infection. If you have a co-infection, meaning that you got hepatitis B and hepatitis D simultaneously, you only have a 5% chance of getting a chronic infection. In a healthy individual, there is a 95% chance that if you are co-infected, that you will recover from both infections without complication. Signs and symptoms of hepatitis D are very similar to the signs and symptoms of hepatitis B and are as follows: fatigue, abdominal pain, loss of appetite, nausea and vomiting, fever, joint ache, and jaundice. These symptoms will usually present 3 to 7 weeks after a person is infected. The worst process that hepatitis D can cause is cirrhosis of the liver, which is damage to the liver caused by scarring that cannot be reversed. If you look at the picture, on the left-hand side, there is a normal liver. On the right-hand side, there is a liver affected by cirrhosis. Cirrhosis of the liver can cause high blood pressure, edema, enlargement of the spine, internal bleeding that is worsened by the liver not producing the proper clotting factors, ascites, which is fluid buildup in the stomach, hepatic encephalopathy, buildup of bilirubin that can not be filtered out by the liver, causing jaundice, and an increased risk of liver cancer. People that are at risk of hepatitis D are anyone that has chronic hepatitis B. Transmission of hepatitis D is blood-borne, and therefore people that are at risk are intravenous drug users, hemophiliacs, children born to mothers that already are infected, and people that work in institutes where they care for people with developmental delays. It can also be transmitted through sex with an infected partner. Hepatitis D virus is more prevalent in people that live in Africa, South America, and parts of Russia. The decrease in hepatitis B that has happened recently has come about from a better knowledge of sanitation and has led to a lower amount of people acquiring hepatitis D. People living in areas with high amounts of intravenous drug users and hemodialysis patients have a higher percentage of people with hepatitis D. Testing for hepatitis D, it can be diagnosed with a detection of total antibody, EIA. A positive IgM titer is indicative of hepatitis D replication. PCR can also be used and is the most accurate way of detecting the hepatitis D virus. For people that are infected with hepatitis B and are experiencing severe symptoms, it is highly recommended that they are also tested for hepatitis D. Prevention. There is no current vaccination for hepatitis D. However, it can be prevented by receiving the hepatitis B vaccine. Prevention can also consist of avoiding the causative agents. This would include universal precautions that prevent exposure to blood and bodily fluids, disinfection of hospital equipment that may be contaminated with blood or bodily fluids, and by not sharing needles. Treatment. There is no current cure for hepatitis D, and the only approved treatment is a pegylated interferon, an antiviral therapy that is administered weekly for 48 weeks and lowers the amount of hepatitis in the body. What you need to know is if you are already infected with hepatitis B and are experiencing more severe symptoms, it's highly recommended that you get tested for hepatitis D. Vaccination for hepatitis B is the only way to prevent hepatitis D. Also, always use universal precaution whenever you may be exposed to bodily fluids or blood.